friends, welcome back. Have you ever felt exhausted, in pain, and like your body's fighting a battle that you can't see? You're not alone. Today, we're talking about fibromyalgia, a real, often misunderstood condition that affects millions of people. This information has been medically reviewed by Dr. Bard, MD, so you can trust the information is accurate and up to date. What is fibromyalgia? Fibromyalgia is a chronic condition that causes widespread pain, fatigue, and a range of physical and emotional symptoms. It affects about 4 million people in the United States alone, men, women, and even children. But here's the thing, fibromyalgia doesn't look the same for everyone. Symptoms come and go in what are called flare-ups. Days or weeks where pain, fatigue, and brain fog feels overwhelming, followed by times when things feel more comfortable. That roller coaster of symptoms can be exhausting and emotionally draining. Here are some of the symptoms to watch for. Widespread muscle pain and tenderness. Fatigue that doesn't get better with rest. Headaches and migraines. Jaw pain or TMJ disorders. Digestive problems like IBS. Bladder control issues. Emotional symptoms like anxiety, depression, or insomnia. And the so-called fibro fog. Memory or concentration problems. So, what causes fibromyalgia? Here is the truth. Experts don't fully understand what causes fibromyalgia. But research suggests genetics may play a role. If a parent has it, you might be more likely to develop it. People with fibromyalgia often have heightened pain sensitivity, like the body's pain volume control is turned way up high. Chronic illnesses, infections, stress, or emotional trauma can sometimes trigger symptoms. Here are some of the risk factors. You may be at risk if you're over 40. If you're female, women are twice as likely to be diagnosed. living with chronic illnesses like arthritis or IBS, or have had major stress and trauma in your life. Flare-ups can be triggered by things like stress, lack of sleep, infections, hormone changes, or even weather shifts. So, how do you know if you have fibromyalgia? There's no single test for fibromyalgia. Doctors rely on your symptoms, physical exams, and ruling out other conditions with blood tests. It's a process of elimination. So it's important to be open with your healthcare provider about your pain, fatigue, and emotional health. So what are some of the treatments, you may ask? Well, while there's no cure, there are treatments and lifestyle changes that help manage symptoms. Medical treatments may include pain relievers or certain antidepressants. Cognitive behavioral therapy, which is termed CBT. Now, CBT is something that I've taught for years in a mental health system. Sleep therapy and stress management techniques. At home, there's also things that you can do, like gentle exercise, like stretching or yoga, healthy eating, and staying hydrated. Mindfulness practices like meditation. Regular sleep routines for better rest. Pacing yourself. Don't push through pain. Living with fibromyalgia can feel lonely, but you're not alone. There are support groups, online communities, and mental health professionals can make a huge difference. Talk openly with your healthcare provider. Your symptoms are real, and there's help out there. Fibromyalgia may not have a cure yet, but there are ways to manage it and live a full, meaningful life. If you're struggling with pain, fatigue, or emotional symptoms, please reach out to your healthcare provider. Your health matters. Your feelings matter. And you don't have to face this alone. For more health tips and insights, don't forget to like, subscribe, and hit that bell icon so you never miss a video.